Hello everyone, welcome to Healthcare and Beyond. Hello everyone, and welcome back to another episode of Healthcare and Beyond. I'm Dr. Laurie Rosenberg, and we have a fascinating and very interesting show for you today. Today, we are going to be hosting the Department of Health, Rockland County, the Department of Health, and we have with us today Laurie Messenger and Michelle Kleinman, who both work for the Rockland County Department of Health. There's a lot of different programs which our health departments offer, and Rockland County has a very large number of programs. So we're going to talk today a little bit about some of those programs, go into a little bit of depth, and really try and understand, the value that the health department brings, our local health department brings to the health of our community and the wellness of our citizens. We're going to start with Laurie Messenger, and Laurie's going to talk to us a little bit about sort of generally what the department does. And then we're going to break out and talk about some of the individual programs today. We're going to talk about the breastfeeding initiative. We're going to be talking about chronic disease management. We'll be talking about diabetes. We'll be talking about weight loss. And we'll also be talking about worksite wellness. So a lot of different areas that the health department covers. But again, very, very important parts of our lives here in Rockland County. Very important parts of our health and our general wellness. So without further ado, Laurie, thank you for joining us here on the show on Healthcare and Beyond. We're very privileged to have you here, and I appreciate you taking the time, as well as you, Michelle, who we'll see in just a minute, to come and talk to us. Talk to us a little bit about the health department. Laurie, tell us a little bit about the kinds of things that you do.
Sure. Well, thank you for inviting us here.
Oh, sure. My pleasure.
The Rockland County Department of Health works with many community partners to bring about programs that are proven to work, evidence-based and best practice programs to people of Rockland County. The mission of the Rockland County Department of Health is to promote and protect the health of our community. We are lucky to have a vibrant network of hospitals, federally qualified health centers, collaboratives, community agencies that work together to reduce and prevent chronic disease. In the Division of Health Promotion and Chronic Disease Prevention, we use a variety of strategies, some on the community level, such as corner store campaigns, school health and wellness, and some on an individual level, such as smoking cessation, fall prevention, matter of balance, and we also focus, as today, we're going to be focusing on chronic disease self-management. We have a program on chronic disease self-management, diabetes self-management. We have diabetes prevention program. Mm-hmm. We have a Lose to Win program. And we have
That's a good title, Lose to Win.
Lose to Win. And breastfeeding support and prevention and worksite wellness programs, which actually work on both the environment of the worksite and the individuals at the worksite.
Okay.
So it's a general overview.
Here's a sort of and I do want to go into talk about breastfeeding and worksite wellness, but here's a kind of a strange question. Sometimes, it occurs to me, who decides what programs to offer? How do you know whether you're going to offer breastfeeding? How do you know whether you're going to offer worksite wellness? How do you know, not to offer certain kinds of programs? Are the choice of what programs the health department offers based on, is it based on epidemiologic data? Is it based on, current trends? So where we see people getting ill in various parts. What kind of a decision-making process goes into deciding what programs are going to be offered? Because it's a lot of resources, obviously that are involved here.
Well, the prevention agenda that is the main prevention agenda goals are to reduce obesity. So a lot of these programs are aimed to help reduce obesity, such as which leads to chronic diseases. So. The CDC has a whole list of programs that are evidence-based, things like that. So breastfeeding is one of them, the chronic disease management programs, things like that.
Okay.
So, Part of it is basing it on that. Part of it is basing it on grant opportunities that arise through whether it's the New York State Department of Health or grants like
or
the
federal
worksite
grants.
Yeah, they're out there that we apply for.
Right.
And that's how some of these programs get started. Like we have the Creating Healthy Places to Live, Work, and Play grant, which has a community side. It has the worksite wellness side of it. So, basically, and just knowing, again, concentrating on programs that we know will make residents healthier, whether it's quit smoking, fall prevention, things like that. So reducing obesity in the schools, that's our so it's all that to reach the prevention agenda goals, which is to reduce obesity, reduce chronic diseases.
Right. Here's another question for you. Again, this is a little off our agenda, but I'm just curious. What makes you interested in working for the Department of Health? What was it made you decide that you wanted to do this? Which is really, I think it's a great thing to do. I got to tell you, but you obviously were motivated by something.
Well, I've done lots of different programs through the health department. I've been with the county for almost 11 years. With the health department, maybe about 7 of those years, 7, 8. So when I first came on, the program I was working on was that motivated me to, apply to come was to give. We were doing free mammograms and Pap tests for women who are underserved, or uninsured, and colorectal screenings.
Right.
So, I have a history in my own family of breast cancer, so I was very motivated by that.
So there was a certain personal element involved.
Motivated me to, the importance of detecting early, how it really can make a difference, and to make sure everybody has access to that. So I find the department very fascinating, and now I'm into breastfeeding. I'm expectant mom as myself, so this is my third, and breastfed all of them who returned to work, and I understand all the barriers moms can face, and I'm also certified as a lactation consultant and worksite wellness specialist. So I bring all these skills that I've developed through my being at the health department, and it's it's been a very rewarding experience. And
so, it gives you an opportunity. Well, it gives you an opportunity not only to help people in a very tangible way, but also, it sounds like you got a whole number of different skills that you have, and you're able to channel all those into working for the Department of Health. So they're lucky to have you, Laurie.
Oh, thank you.
Let's talk a little bit about worksite wellness. I have to confess that there's some things that I know a little bit about. There's some things that I know very little about. There's more things that I know very little about. There's lots of things that I know nothing about. But I don't know a lot about worksite wellness. So tell me what you can about worksite wellness.
Okay, well, I could tell you a little bit about our program. So I am a certified worksite wellness specialist, and I help coordinate the Healthier Worksites, Healthier Workers program. This program is designed to assist Rockland County worksites to improve their employees' health and wellness. Worksite wellness programs have been shown to reduce employee stress, healthcare costs, and absenteeism, and also increase productivity and morale, and loyalty. So the program aims to initiate or enhance existing programs within Rockland County worksites. So some of the services that we offer...
Anywhere within Rockland County?
Anywhere within Rockland County. And some of the services we do offer to Rockland employers are 1-hour assessment and consultation to determine the areas of need, and provide program recommendations, assist with development and maintenance of worksite wellness committees. It's important to have a wellness committee within your worksite because you need key players involved, a little bit of senior management support, and then a little bit of your workforce. So this way you're reaching all their needs. A monthly wellness newsletter or other information we'll send out. We encourage the implementation of worksite policies and programs that are conducive to healthy behaviors, such as we have the healthy meeting guidelines, which we encourage worksites to sign. And we'll give them a little certificate that they can hang up and promote. But what it is saying when you have your meetings, make sure you have a healthy option there that you can serve, whether it's fruit or salad. Don't just have the donuts and the unhealthy things.
Sure.
You always have a healthy option. So you're making a commitment and you're promoting that. And also it talks about when you have your meetings and you're you're sitting so long. It's not healthy to sit so long either, and for your brain and for your body.
Right.
So it also talks about getting up once in a while and do some stretches. Do stretches with the group. Even just for 5 minutes, just get up and take a quick stretch and get back to your meeting.
Okay.
So that's the healthy meeting guidelines. And then we have vending and cafeteria policies that we can help, and a farm to work program, which I love. It's one of my favorites. And a lot of our work sites do participate in this farm to work program. And what it is you can do farmers come from different, some of them are upstate, different areas, but a couple of them are like Wright's Farm. We have Globaki Farm that come down and they deliver fresh produce right on the work site. So you're making it convenient for the employees to get access to increase their fruits and vegetable consumption. And also help the local economy. I have to tell you that
the last program that I did, we had a guy who was a chef, and his name was Todd Villani, and he's got this restaurant called Terre à Terre. You been to Terre à Terre? I went to Terre à Terre, but I didn't get to eat there. I went there at 9 o'clock in the morning to interview Todd, and I smell all the food, and I'm thinking I really want to eat something, but I had to leave. Anyway, Todd was a great guest, and we did a show here with him, and he actually prepared something for us. And he's really very much on the forefront of the farm-to-table movement. And it's interesting because there's so many facets and there's so many ways in which that farm-to-table movement has an effect. I mean, not only is it healthier, not only is it generally way better tasting, but it helps the economy. And again, it doesn't only help the local economy because you have your local farmers and everything else. But there's an interesting statistic. Apparently, somebody did this study and found out that your average container of strawberries travels an average of 1,300 miles to get to your table. So from the time it's picked in, I don't know, Ecuador or California or wherever they pick strawberries, by the time it gets to your table, it's traveled 1,300 miles, which meant that you have 1,300 miles worth of gas and pollution and all this other stuff, and cost. So not only does sourcing locally decrease your costs, but it has a tremendous effect on the environment. It is amazing, Anyway, we got into this whole discussion about it, so I didn't mean to interrupt you, Laurie.
It's my favorite. It's one of my favorite areas because it's on so many levels. It's such a wonderful program.
Yeah.
And there's two parts. There's a community-supported agricultural part, the CSA. I don't know if you've heard of that.
That I haven't.
But that's where, in the beginning of the season, you pay for it up front, so the farmers can grow their crops.
Okay.
And then what happens is when the season starts, you get a weekly delivery of a box of different variety of vegetables.
So whatever
fruit.
happens to be in season.
Exactly, and what they grew.
Oh, okay.
So you pay ahead of time. So that's the community support agriculture, and then you just get it every week. You get the delivery.
That's delivered right to the work site.
It's delivered right to the work sites. It's very convenient. We encourage people, if they can't afford the full season, that they could share it, or split it. And then what's nice is when these farmers come, they also set up tables and do some on-site sales.
Okay.
So people who aren't part of that program can still come and get their fresh fruits and vegetables, like almost like a farmer's market.
Oh, okay. So a farmer's market right at work.
Pretty much, yeah.
Can't beat that.
So we have lots of work sites. This is our third year doing this, and more and more work sites are we refer them to the resources, and they've been having them come to their work sites, and employees have been loving it, and they send us pictures, and this is part through our Creating Healthy Places to Live, Work, and Play program. So it's and what I love about it is it's not even helping the employees increase their vegetable and fruit consumption. It's also helping their families, because remember, they're going to bring this home. So it's also helping teaching your family to eat healthier. Yeah. And like you said, and it's so important. Like, I've had their nectarines. They're so delicious. And then when I go to the grocery store and buy them it's not the same.
Oh.
It is not the same.
Yeah, it makes a big difference. It makes a
does.
huge difference.
Yeah, so that's a great program. And then in addition, we do consultation, and we do measure, we go out to work sites and we can do measurements, and we can provide signage for indoor and outdoor walking paths.
Okay.
So we encourage work sites to encourage walking, for their employees, and we have like shoes, they're like big shoes, and like with signs with arrows pointing, and you can create like a whole path. So, and then we can draw a map out for them, and then they can promote it to their employees, so encourage them to walk on their lunch breaks and on their breaks. And we can do it inside too. And then we also have stair signage we can provide for promoting the stair use. So instead of using the elevator,
Right.
Encouraging employees to use the stairs. So also we do coordination of lunch and learn programs using our internal staff and sometimes other professional staff throughout the county, some of the hospitals that we work close with, and on a variety of health topics such as nutrition, breastfeeding, stress management, chronic disease like diabetes, osteoporosis, cancer, Lyme disease, and physical activity and exercise. So we can bring these to the work sites and do these like lunch and learn type of programs. And then some of the other on-site programs that we can also offer work sites is our Put It Out Rockland, which is like an 8-week group smoking cessation class. We do the Lose to Win class, which is an 8-week group weight loss program. We offer that, and these are all on site at the work sites that we can do. Tai Chi, we have someone certified in that, and they can do an 8-week Tai Chi class. Diabetes prevention program, which that one's a 16-week lifestyle change weight loss class. For individuals diagnosed with as pre-diabetic or at risk for prediabetes.
Okay.
So those are some more programs that we can offer at these work sites. We've done, with Michelle, we've done cooking demonstrations that highlight quick and easy nutritious recipes. And also we have, this is great, a salad and soup club starter kit. So we have a CD that we can give out to work sites, and it has over like 40 recipes of different types of salads. And we have a sign-up sheet that you can print out. And so what you do is, employees can sign up for like a little ingredient, and then they'll bring it, and you put it all together, and you have a different salad every week. But everybody participates and brings something to make a healthy salad. So that's a lot of fun. Or you can do like a soup club. So we provide guidance and recipes and the whole CD on that. Yes, it's so much. We have a variety of educational materials, including brochures, posters, handouts. We have some biometric screenings that we can offer, like BMI and body fat percentage.
And you do that right there?
We'll do it right at the work site. What we do is we try to have it be coordinated with, like, Nyack Hospital provides free blood pressure screenings. They can do that on the work sites. And so we also tell our work sites, well, we can come and also offer, to make it more comprehensive, we can do the BMI, we can do the body mass.
Which I'm sure very few people have had that done.
Yeah, no, it's kind of neat. It's a little thing, it just reads your...
They did my body fat one time at the gym.
Yeah.
I told them they were way off. There was no possibly, but I don't remember what it was. I sort of blocked it out, I think.
Okay, yeah. Yeah, some people like doing it, some people like, I don't want to know, you know.
Yeah.
But I think it's helpful, especially because sometimes BMI doesn't tell you the whole story, so it's good to do both together.
Oh, yeah.
Especially if you're like a bodybuilder or something. So. And we also do provide technical assistance by a trained international board certified lactation consultant, which I am.
Right.
And to help develop worksite lactation programs, which that's very important too.
I've noticed that becoming...
Yeah.
Well, probably over the last 10 years or so, really becoming a much greater awareness of it.
Right.
I mean, there was zero awareness of it when I
Yes.
was coming into the workforce.
And it's a labor law, so work sites do have to accommodate moms who are returning to work breastfeeding.
Right.
They need to have some accommodation for them,
Right.
even if it's not a designated space, but it's a law, labor law, and they have to allow them time to actually pump, whether it's paid or unpaid, but they still have to allow them time to do what they need to do so they can continue and be successful. And other worksite wellness resources and technical assistance to accommodate the needs of individual work sites. So those are just a little, little examples of what we can do, what we can offer. It's just a lot. I was going to say a little, but it's a lot. And just so you know, we've just finished. We're finishing up our last year. We did get a 5-year grant, Creating Healthy Places to Live, Work, and Play. I think I mentioned it before. It was a grant awarded from the New York State Department of Health. And through this initiative, we are working closely with 20 small to mid-sized employers right now. So that's anybody under like 1,000 employees. One of our work sites is a little over 1,000. But to implement these comprehensive worksite programs and additional benefits and services. So, but again, these are all examples of what we do with them and what we could do with other work sites too who contact us.
One question I have for you, and there's I mean, this is a several-hour discussion, all the different things that you offer. But there are a couple of things I wanted to ask you about. How do you decide who's going to participate? Did people, does a company apply to you? Do they set up an application? Do they talk to you? Or do you go ahead and choose a particular corporate? I mean, I imagine there are probably corporations and office buildings and that sort of thing that you where you do your, the worksite wellness.
Yeah, I mean, we've promoted, our program before, especially because with this grant, we did have to recruit 20 work sites. So, we would do press releases, we would promote, but so the work sites would contact us, when they, if they would see us listed on the website, our service is what we can do. So we get a lot of contacts through the work sites.
And without mentioning any particular names, what kinds of organizations, participate?
We have all different variety. We have from like line workers, like a factory type of facility, to a hospital, one of our local hospitals, to it's all different variety of work sites.
So you public and private sector.
Oh, yeah, correct.
Okay. And people who will be just a service organization, and people who, produce things at the factory.
Right. We have
offices.
Public and private work sites.
So
actually,
a whole variety. Okay.
Yeah, and some unionized, some not. So and that brings its challenges too.
Sure.
So yeah, that's definitely good variety.
Yeah. And by and large, how have they been received, Laurie? Have you had a pretty good? I mean, I imagine you probably have, but have people come up to you and say, "Hey, this is a great program."
Oh, yeah, they really appreciate it.
I can see all the different things that you offer.
Oh yeah, I mean the employers, the employees, they really appreciate it. Like I said, all the things I said before, how it just really improves morale, loyalty, and it shows that the employer appreciates their employees by having these worksite wellness programs. I think it's really impactful. And again, it helps reduce insurance costs and those premiums.
And as you
by
mentioned,
trying to get them off
loyalty and morale and all those other things. Yeah, which makes a big difference,
Exactly.
Interesting.
So it's a great program, and it's all these services we offer are free. So, which is great.
Well, one of the programs that you mentioned was breastfeeding, and I think we need to take a little break here.
Okay.
And we will come back in just a few minutes. We're here with Laurie Messenger from the Rockland County Department of Health. You are watching Healthcare and Beyond with me, Dr. Lawrence Rosenberg, and we will be back in just a few minutes to continue our discussion, our fascinating discussion about the Department of Health, and I'm learning an awful lot here. See you in just a few minutes.
If your kids drink 1 bottle of soda a day, they're eating 50 pounds of sugar a year. 50 pounds of sugar from just 1 soda a day. So don't drink yourself sick. Go with water, seltzer, fat-free milk, or unsweetened teas instead.
Welcome back to Healthcare and Beyond. We're speaking with Laurie Messenger here from the Rockland County Department of Health. And I did mention, Laurie, for people that want to contact the Department of Health, whether it's a business, whether it's an individual, whether somebody is interested in one of the many programs that you have, or just general information, how's the best way to get in contact with the Department of Health?
The general number, the best way to reach us for any of these programs is 845-364-2500.
Okay,
easy
repeat
to
it one more
remember.
time for us, Laurie.
845-364-2500.
Okay, so that's a number for the Rockland County Department of Health for those of you who are interested, and I find myself ever interested and ever fascinated by our discussion here. I've been in the healthcare field for, it seems like a millennium, but certainly about 30 years or so. And I was just fascinated by this week, going through the website, going through articles and press releases and newspaper articles and TV programs about the Department of Health. There are so many things that our Department of Health does, both at a state level, a federal level, and at a local level, to ensure the health of our citizens, to promote wellness, to promote good health. It's really amazing. So I'm fascinated by this, and I'm glad that we have the opportunity to learn a little bit more about it. We had mentioned, Laurie, in talking to you about the worksite wellness, a little bit about breastfeeding. And breastfeeding, at least in my own experience, awareness of breastfeeding has become more prevalent in just that I can think about, certainly in the last 10 or 15 years. And there's been an increased awareness and an increased emphasis on the importance of breastfeeding. Let's talk a little bit about the programs, and then after that, I think maybe we can talk just a little bit about why breastfeeding is so important from really a nutritional perspective. But tell me a little bit about the program, which obviously is a very important program here in Rockland County.
Sure. So I coordinate the Rockland County Department of Health's breastfeeding promotion and support program.
Right.
And I am an international board certified lactation consultant who provides free breastfeeding services to pregnant and breastfeeding mothers in our community.
Right.
Some of the services are breastfeeding counseling in person or over the phone or through the email. I provide support and also referral and resources as needed. I help with any breastfeeding challenges the mom may have.
Mm-hmm.
I also help run, we do prenatal and breastfeeding classes and presentations, support groups, and through the community in coordination with the Women and Infant Children Program.
And that's a federal program, WIC,
Yes, WIC.
is it
Yeah,
WIC? Is that what it's
WIC,
called?
Yeah, Women and
Okay.
Infant
Right.
Children Program.
Yeah.
So we do support groups together with them through the different parts of the county, like Nyack, Spring Valley.
Right.
And basically, it's Haverstraw and Spring Valley.
Mm-hmm.
And we also do guidance for employers on establishing a work site or like a daycare lactation program,
Okay.
which I mentioned a little bit through the work site program, but also daycares. It's important for daycares to also be breastfeeding friendly.
Right.
So when a mom does return to work, the daycare providers can also help a mom be successful. So there's certain things that daycares can do and be designated as like a breastfeeding friendly daycare
Okay.
to help support those moms. And also we do provide guidance for OBs and pediatricians' offices on how to become designated as a New York State breastfeeding friendly practice.
Okay.
That's the new push now, just like the hospital initiative to
Right.
reach those 10 steps to a baby friendly hospital initiative.
Right.
Now they have these 10 steps also for practices, OBs and pediatricians' offices, encouraging them to develop policies and to and do these 10 steps to become, recognized as being breastfeeding friendly,
Okay.
and to help support the moms better.
Mm-hmm.
And all these different things you can call to get more information. My direct number is 364-3786 for the breastfeeding program,
Okay.
or you can call the general number too. But basically, that's the rundown of what we offer for that program.
Okay.
For optimum nutrition and growth and development, the American Academy of Pediatrics and the American Congress of Obstetricians and Gynecologists, the World Health Organization, the U.S. Department of Health and Human Services recommends that babies are exclusively breastfed for the first 6 months of life, with then the introduction of complementary solids, and then continued breastfeeding through the first year of life and beyond, as long as it's desired between mother and baby. So basically, babies should continue to breastfeed for a year, and again, we want to encourage them, encourage moms and support them so they can be successful at achieving these goals. Just some percentages. I mean, basically 83% of new moms in New York State initiate breastfeeding, but only 53% of infants are breastfed for the recommended 6 months. Basically, only 17% of infants are exclusively breastfed for the first 6 months, which is far below the Healthy People 2020 goals of 25.5%. So our program goals are, as breastfeeding is a proven public health prevention strategy in reducing obesity. So obesity leads to chronic diseases and impacts our economy. So CDC, the Center for Disease Control, they say a woman's ability to reach her breastfeeding goals is affected by a host of factors, including support from her family, from the community, from an employer, from the health system. So to improve our breastfeeding exclusivity and duration rates, it's important to have these supports in place and to help reduce the barriers so moms can be more successful. So that's what our program aims to help to do. By making affordable and easy access to the community to help, again, remove any of these barriers that women may face when they're discharged from the hospital. So that's basically, what I
Here's a funny question, among many funny questions that I seem to ask all the time. Reduction of obesity with breastfeeding. Is that reduction of obesity in the kid or reduction of obesity in the moms?
It's a good question. It's basically shown for both, actually. You're reducing the obesity, you're getting your child off to a healthy start in life.
Right.
You're reducing their chances of being overweight or obese in adult life.
Right.
And then for the mom, by making milk, you burn over 500 calories just by making milk.
Right.
So moms can get to their weight, their pre-weight much faster when they're making milk and breastfeeding. So there's lots of good advantages to mom by breastfeeding.
Right.
So
now you mentioned that you, I mean, not only are you an official within the Department of Health administrating this breastfeeding program, but you're also a lactation consultant yourself. What does that involve, being a lactation consultant? What kind of, things do you talk to the moms about, prospective moms, moms that have had kids before? Where do you sort of see your role there?
Well, I talk to them about, prenatally, you want to talk to them about the benefits of breastfeeding and why they should choose breast milk over formula.
Right.
Encouraging them to, with all the benefits that, like I was saying, to the mom, such as losing weight, but in addition, it reduces their risk of developing breast cancer, ovarian cancer.
That I didn't know. That I had no idea about.
Yes. There's lots of great reasons for a mom to breastfeed. Of course, it does promote bonding with the mom and baby.
Right.
But then also
so the psychological health of the baby, and probably the mom also.
Yes, because the mom's always got to take a break and got to take that baby and just bond with the baby and nurse the baby. So it forces that mom to stop whatever she's doing.
Right.
You can't just stick a bottle in the baby's mouth. You got to stop and hold that baby and just reconnect. To me, as a breastfeeding mom myself, it's one of the many things I cherish about it, was being able to just escape and go with my baby and just, breastfeed and kind of block everything out for a while.
And also know that you're doing something good for your kid. I mean, something that's historically been considered a good thing, which, modern evidence, our scientific evidence has only reinforced.
Right. Actually, benefits for the baby, according to the Centers of Disease Control and Prevention, breastfeeding can reduce.
There's that CDC again.
They have a lot of good research, and but they say breastfeeding can reduce a baby's risk of respiratory illnesses, allergies, asthma, obesity, diarrhea, sudden infant death syndrome, ear infections, and other illnesses. So again, breast milk is nature's perfect food. I mean, it's breast milk has living cells that formula doesn't have that help fight off these illnesses. That's what makes it so unique and so important. And that's why we have to support those moms, because this is this is what can again, help our economy, help, by keeping the babies healthy, and again, reducing obesity risks, and reduce absenteeism at work and things like that, because you're less home with a sick child.
Well, also
by
because
breastfeeding.
if it again in line with the worksite wellness initiatives that you're talking about, now that people are more aware, and employers have, certainly come to devote resources to breastfeeding, you can do it, you can pump at work and,
Right.
be able to, not have to take a day off of work, or take a half a day off, or take some time off from work. It so increases productivity. I mean, it does any number of things,
Exactly.
The other thing I was curious about, you had mentioned, and we didn't really talk about this much with worksite wellness. I think that we're going to end up talking about a little bit more when we come to chronic diseases and diabetes. But you did mention partnering a little bit with some of the other hospitals and some of the other OBGYN practices. Is that something that's part of the program?
Yeah, I mean, we're developing, the New York State Department of Health has developed a program, the 10 Steps to a Breastfeeding Friendly Practice.
Right.
And so we are going to roll that out the next year, this coming year, of encouraging practices to get designated by agreeing to these 10 steps. They may have to make some changes. There's like an assessment form where they'll have to assess their practice, what they're currently doing, and then what they can do to improve it. So we want to really encourage them to get on board, and we're going to host we're planning to host a certified lactation counselor training. It's like a 45-hour course sometime in next summer, and offer it to, there's a limited number of scholarships, so we're going to try to offer it to some of the pediatrician OB's offices.
Oh, so this is for medical professionals, docs and stuff, right?
Well, anybody in their office could go get the training. It's
Okay.
just to help make the practice more breastfeeding friendly.
Right.
So somebody calls, has a breastfeeding question, somebody there can actually help them, which would be great, or be able to refer them to, get more help if needed.
Now you had mentioned, and if I can recall correctly, and my memory is not only is it not as good as it used to be, it never was very good. But I think I wrote down something like 83% of moms do breastfeed initially, but it drops down to about something like 52 or 53% by the 6th month.
Exclusivity.
What's the goal? Is the goal to have 100% by 6 months? To have every mom that can breastfeed, and have them do it for the whole 6 months or for a year? What's sort of like a reasonable goal that you would set for the next 5-6 years, whatever?
It's the Healthy People 2020 goals are set. They have them set for what they're looking for. Yeah, nationally, and then I guess we have our rates. So I think it was around 25.5%. Was the goal.
The national goal.
Yes.
Okay.
Yeah.
Okay.
So, but we have a long way to go. Initiation rates, we're right at par. I mean, I think we might be even a little higher.
It sounds like it sounds.
Yeah,
That actually
initiation
sounds like a very
is great.
high number.
The hospitals,
to me.
are really working hard to really encourage skin to skin, and put the babies to the mom, bring the babies to right after birth.
Right.
Promote the breastfeeding, but it's when they get home from work. Well, when they get home from discharged from the hospital, they have obstacles that they may face out there. That's when some of these breastfeeding challenges may start, like lack of support from their friends and family, lack of opportunities to communicate with other breastfeeding moms, lack of update instruction on and information for healthcare professionals could compromise their breastfeeding relationship if they're not getting the same messages. Some practice, people practice differently, and they might have different opinions or not up to date on their knowledge of breastfeeding. That's why it's important to have someone certified
which is what you guys
in their office.
help to provide with the program.
Exactly. But it helps to have someone in the practice who can train the others in the office, so everybody's on the same page, and then hospital practices that make it hard to get, that make it hard for moms to get started, to be successful. Could be a barrier, and lack of time and accommodation for moms to breastfeed or express at their workplace is definitely a barrier that will obviously can make a mom stop breastfeeding much sooner if their workplace is not supportive. So it's very important if we want to increase these rates. That's why we do have to work with the work sites too and really encourage them so we can help moms achieve this. And again, embarrassment and disapproval. Unfortunately, it still happens sometimes when moms do breastfeed in public. Once in a while, that does happen. But there is a civil service law that's been around for almost 20 years now, New York state civil law, that a mom can breastfeed anywhere where she's allowed to be, whether covered up or not. So.
Just a quick question before we finish this segment, Laurie. What is your sense? How does Rockland County compare with some of the other counties, some of the other parts of the country, some of the other states? I don't want to say internationally because that's sort of an unfair question, but how are we doing in our breastfeeding initiative, in our awareness as a society as to the importance of breastfeeding? How is Rockland County doing relative to the rest of the country, would you say? Just your impression, nothing scientific. Are we pretty much ahead of the curve? You think we're behind the curve? You think we're right where we should be? What's your sense?
I think things are definitely getting better, but we still have a ways to go.
To go,
because I hear stories from my moms, what I can go by is the stories I hear.
Right.
And I've had moms that go back to work and are having challenges with their employer, giving them the time that they need, making it inconvenient. Those challenges they have to face, and then again hearing stories in the news, recently in Rockland, about moms being told to cover up at a store, or they had to leave the store because it was against a store policy, which laws override any store policy. But if a mom doesn't know her rights, it could be very discouraging, and so I think it's just, again, you think 2014 we should be, past all this, but we're not. So we still have some educating to do and supporting for these moms. But we're definitely, there's lots of more support out there. I find that that moms have opportunities now, more and more. And again, we have the health department programs. We have the hospitals have programs.
Right.
We have WIC, the Women and Infant Children program, has breastfeeding WIC peer counselors. So we're really trying to reduce any gaps. So
still a challenge.
Yes, but, still a challenge.
One that we're working hard on.
Exactly.
I do want to thank Laurie Messenger for talking to us about breastfeeding, talking to us about worksite wellness, two very important programs here in Rockland County that the Department of Health is very much involved with. We're going to take a short break now. We will bring Michelle Kleinman to talk about obesity, weight loss program, and diabetes as well. Laurie, thank you. It was very nice talking to you. It was very interesting for me.
Yeah.
I learn a lot, as I always do, but really, really, really interesting. We will be back in a couple of minutes. Healthcare and Beyond is the name of our show. I'm Dr. Lawrence Rosenberg. We'll see you in a bit.